AI, AR, what have you in healthcare. That is a whole different ballgame. So that's something that we really need to talk about. And this is what we're going to do with our next speaker. He's an attending intensivist specialized in the development of innovative techniques. He's also the co-founder of a very important lab. It's called the Responsible and Ethical AI in Healthcare Lab, or as we like to call it, the REHAHEAL. I think that sounds good. So please welcome to the stage, Michel van Genderen. Hey, Michel. How do you call it yourself, the lab?
Real.
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 That's
but I liked your way of pronouncing it.
That is way better. So I'm going to give you the clicker, and then I'm going to give you the floor, and I'll see you back in a few minutes.
Let me check if I press the right button. So, stand in the light. Thank you all for attending. I'm really anxious about telling you what we are doing in healthcare. So, I have 10 minutes, which is actually a bit short, but also challenging to take you into our world, some sort of deep dive. So I will stick to the most important message, what we have learned the last couple of years. And this is where it all happens. This is where I am working actually most of the day. It's the ICU, a couple of kilometers from here. It's the Erasmus Medical Center. And I can tell you from experience, it feels amazing taking care of critically ill patients, because that's what we do at the ICU. We are responsible for taking care of the most critically ill patients in the hospital. And sometimes it feels very comforting if we are able to save somebody's lives, which of course is not my effort. It's a team effort. So I'm happy to talk with you about it, but it's also confronting because it's all about the patients and the people. So therefore I'm happy standing here. Because I'm happy to work at Erasmus Medical Center. I'm also actually happy to work as a physician in the Netherlands because we are used to a very high standard of healthcare quality. And it's my message, and it's my mission actually, to keep this quality of care, which we are all used to, for us, but also for the future generations. So, but then how are we making sure that we keep this healthcare quality that we are used to for us, for the future generation, with all these challenges coming our way? And how then we cope with all these AR and AI improvements, but because these are also coming our way. And this is a patient. This is from a patient perspective. First, the physician perspective, and this is a patient perspective. And imagine lying in that bed 24 hours a day, 60 minutes an hour, hearing all these beeps, sounds, and noises. Let me get back. It doesn't work. Imagine that. Imagine that the only thing that you can cope on is the people taking care of you. As a patient, you have only one thing when you're lying in that bed. You need to have trust. Trust in the people taking care of you. But then how do we translate that trust if we will change healthcare, making sure that we use AI algorithms, AR innovations? How can we maintain the trust for that patient lying in that bed? Because these are the challenges I was talking about. In 2030, we have 3 times more shortage of healthcare personnel than we have now. And we are already running and pacing with everything we can do. From an ICU perspective, we have more than 1,000 FTE of personnel shortage in 2030. And maybe more importantly, 25 to 30% of our nursing staff will retire. So that means a lot of experience will leave healthcare. So then, with these challenges, how can we maintain the quality we are used to today? And this slide actually summarizes it very nicely. We are confronted with an increase in health demand and also with a decrease in healthcare professionals. And from my point of view, it makes sense to invest in data and technology because training more and more personnel won't fulfill the capacity we need to maintain care in 2030 and even in 2040. And it makes sense to talk about AI because from a community perspective, we are confronted with an unprecedented speed of AI adoption. And let me check. On the top right for you guys, you see Google Translate, innovation from a couple of years ago. It needed 78 months to reach more than 100 million users. And then when you scroll down the bar on the top side, you see TikTok only needed 9 months to achieve more than 100 million users. GPT only needed 2 months. So from a community perspective, you see that this adoption of AI is accelerating at a very much increasing pace. So how is this community AI adoption perspective, how can we translate that to healthcare? And this graph actually nicely summarizes it. On the top, you see the year numbers, and on the other side, you see the levels of readiness. And the levels of readiness are from NASA, and they developed this technology readiness levels to determine whether a technology is ready for clinical usage. For instance, when you talk about a rocket, if a rocket reaches technology readiness level 9, the lowest level, it's ready for being sent out in space. And when you translate this TRL criteria to AI in healthcare, you see that all the AI models tend to persist in TRL level 3 and 4, in the model prototyping and model development phase. While the desired movement is moving these AI models and solutions to the clinics. We need to adopt these AI models and all these innovative solutions at the bedside. But how then can we bridge this gap? Because it's not only about talking about predictive AI and that we can build very innovative models, it's about making them tangible. They need to be actionable. Patients need to have the trust that what AI says is true, but maybe more importantly, the healthcare professionals, the staff members need to have that trust that they can trust the models on such a point that they can build their decisions on it. And this is what we learned the last couple of years. We need to bridge a gap between what is going on here with AI solutions, XR, MR, all these kinds of innovation, to the healthcare professionals. So therefore we founded a data hub. That's a physical place in our hospital where we combine all this knowledge and where we formalize our approach. We are making sure that data engineers, data scientists, patients, and more importantly, healthcare professionals come together at a very early pace to determine a true clinical problem. Because only if you determine what you want to solve, then innovation and AI solutions can help you. Yeah. And that's what we did. So in our hospital, we have, on our ICU, we are the largest ICU of the Netherlands. We have 230 ICU professionals. So before we started with this endeavor of adopting and using AI, we talked to all of them. So we held different sessions, and we asked them 3 questions. What is your main clinical challenge? How do you think that technical innovation, in this case AI, can help you? And what do you need to trust and use this AI at the bedside? And I was thinking of, changing healthcare and attracting the most brilliant minds from the TU Delft, and I would ask them to develop the most complex models. But what the nurses wanted actually surprised me a bit. They wanted something to help them with the administrative burden. Because 38% of their time on a day-to-day basis goes into administrative work. And this is equal for physicians, young physicians in this case, but also for healthcare professionals, in this case nurses. And when you translate this to a poll in our hospital, I was really confronted because 72% of our nurses have the feeling that due to this administrative burden, they don't have the time to give satisfaction to a patient, in this case, holding somebody's hand or comforting somebody, which is mind-blowing. I mean, healthcare is about care, it's about patients, and it's about people. So this is our ICU. We have 5 different units, all 10 beds, so a total capacity of 56. And when you walk up the hallway or the dorm, you see your screen. And this is what we built for them. Because from our polls, they wanted something to help them with administrative burden. They want to centralize it, all the patient information onto one screen. So for me, it felt like low-hanging fruit, or maybe easy picking, other way around. But this is what they wanted. They wanted to have all the patient information centralized. And when we are talking about AI, all these models had to run at the same landing zone. And when you zoom in, it's a real simple solution. Combine all the info of the patient they need to make the decision on, but also let AI models run on that landing zone. So it feels a bit easy, but it really, how do you say that? We at that point acknowledge that when we are talking about innovation, we tend to talk about innovation from a technology perspective. We can build this model, we can build that model. But it's actually about tackling the true clinical challenges, how easy as it sounds. And when we talk, when I have this presentation before other people in healthcare, I feel some hesitance. But when you ask the nurses if they feel ready to use AI, more than 70% feels ready to adopt these innovations. But yet, it has to be in a responsible fashion. So it is our challenge in this room to build models in such a way that we can explain them to the patients, but also to the staff members in the hospitals. So, to wrap it up, because I don't have that much time, I think that the ICU of the future is about improving job satisfaction, but so is listening to each other, because not only the patients, but also the staff members come first. And I think that we have to realize that AI is not about the technical solution, but AI is about helping staff members, helping people to maintain the human touch in healthcare. And this is also what Dirk de Wachter described in his book. And Dirk de Wachter is a famous psychiatrist. He was admitted at the ICU. And in his book, he really nicely described what being ill did to him, lying in the bed, lying at the ICU, needing to put the trust in patients taking care of him, seeing all these nurses running around, all these doctors running around, and then at one time point, somebody approached him, walked into his room and held his hand for more than 20 minutes. And during his months of ICU recovery, he never experienced that. And he really wrote it nicely in his book. Those 20 minutes were the most important 20 minutes of my ICU admission. In the end, that the woman that held his hand tended to be a cleaning lady, but that's actually the message. It doesn't matter. We need to do everything in our power to remain the human touch in healthcare. So I hope that we all can contribute to this challenge. Thank you.
Such a powerful story. Are you open for some questions from the audience?
I needed to keep it short, so for the questions.
Oh, you did great. Is anyone who says, I'd like to ask a question or have a follow-up suggestion to this wonderful story? I'm scanning the room. People are blown away by your story, I think. Am I right? Yeah, I see some hands there. So, okay, just give me a moment. I saw a hand over here. Yes, I'm going to give you the microphone.
My name is Pim, and thank you for your story, Michel. My question is, your solution, I like how simple it is, because simple solutions are the best. And I was wondering, in what way is it just putting all the data together and putting it on a dashboard? And in what way does it actually use AI? Do you have like an LLM running in the background doing some vector searches? Or it seems to me the dashboard itself is enough to make the difference.
Great question, and I really like your feedback because I agree. The most important solutions are the simplest solution, but you have to see this dashboard at a landing zone. So the thing we need to grasp is to bridge the chasm of AI adoption, you need to present maybe all the solutions in the simplest ways as possible. So maybe first start what the challenges are in healthcare, present it at a very simple way on a dashboard, but you have to make sure when you're building it that the dashboard has the capacity to put all the AI knowledge in that dashboard. So this is the first step, just showing the information on a really simple dashboard. but it's actually also a landing zone of all the AI models. So when you touch the screen and you flip it, you will see all the AI models presenting the output and the patient information. So it has a dual function.
Pim, are you happy with that answer? Okay,
so this is not the model I show you. So I'm not talking about AI. We will present the different AI models on this solution, on this landing zone.
Right.
So this is just the interface.
I saw a hand here. Yes, sir. Could you also please your name and your question?
Yes. Joost Bode, hi. Thank you for your story. You were saying by using AI, you can make more time free for the healthcare professional to comfort people. But you also see AI or artificial intelligence or automation or digital devices being used to comfort people. What is your view on that? And are you also looking into that?
Great question. So when we implemented this, we saw a 30% increase of job satisfaction, and there was more than 90% of the nurses were happy with what we provided with them. So what we are aiming for in the future is to assist or to implement AI in such a way that can ease the work burden of physicians and nurses so that in the end healthcare professionals have more time for the patients. So it's an amazing question, and actually some PhD are sitting in the row there. But this is something I haven't thought of. Maybe we can use AI to comfort patients also. So that's looking at it from our other way around. So, and that's why I like to talk in front of such an audience, because you people you have another way of thinking. So maybe we can discuss on that later.
Well, you've certainly sparked a debate. Ladies and gentlemen, big round of applause for Michel here. Michel van Genderen. Yes. Thank you very much.